Hi, I'm Scott Leadingham. Thanks for joining us here in the unique Northwest. News of coronavirus and COVID-19 is seemingly everywhere, with the recent outbreak in Washington so far concentrated in the Puget Sound region. There's much more to consider than reporting new cases and, unfortunately, those who die because of it. How are county, state, and federal officials responding regionally? And does the news coverage match the risk? Many schools have closed for deep cleaning, and many organizations have canceled events as a safety precaution. But is that the right step? We're joined by correspondents today who have been looking into those very questions. First, Enrique Perez de la Rosa in Yakima. Thanks for joining us today, Enrique.
Thanks for having me.
So, Enrique, we'll start with the caveat that numbers change frequently and we're not chasing the whack-a-mole of which place has a new potential case. That said, Enrique, this began as it has been concentrated so far in the Seattle region, but there's been some news on the east side of the Cascades. Just summarize briefly some of the news from the east side.
Sure. So far, there's been no confirmed cases in eastern Washington, according to the Department of Health. But in eastern Oregon, one employee of the Wildhorse Casino in Pendleton was hospitalized in Walla Walla, and subsequently the casino closed for deep cleaning. Other parts of the region include Kittitas, Yakima, Spokane, and Stevens County, where they've sent a series of tests for one or two people that are suspected of maybe having coronavirus. So far, all those tests have come back negative, but it's likely that we're going to see a lot more tests going forward. For one, the virus is thought to have been spreading for a few weeks now, and so people with symptoms might come forward. But also, it's worth remembering that the federal government has expanded who qualifies for testing, and so anyone with a cough, with a fever, with difficulty breathing could potentially get tested for coronavirus with the approval of their doctor.
Right, and we'll again throw out the caveat that as we tape this, that is the news, those numbers where it stands, but those, of course, could change in the intervening days. There have been school closures in eastern Washington and north central Idaho for various reasons that we won't fully get into here. But other than that, I mean, those closures have been out of largely an abundance of caution and to allow time for deep cleaning. And that's what is curious, that word, deep cleaning. When a school, or as in one case, the casino in Pendleton, Oregon, closed for, quote, cleaning, what does that cleaning look like? Like, what actually happens?
Right. So it's really unclear. Deep cleaning can have a lot of meanings, but the DOH recommendations is that standard procedures should be followed right now. It's not really necessary to go beyond and hire outside companies or use industrial grade disinfectants. Custodians are being told to clean with soap and detergent and to use chemical disinfectants like you find in any store, really. What matters is that you read the label on a disinfectant, that it's EPA certified to kill human coronaviruses. Now, you might be more familiar with it saying that it kills 99.9% of germs and viruses. You just got to read the label on the back to make sure that human coronaviruses aren't included within that. It's also important to remember that disinfectants are more effective if you leave it on the surface for anywhere from 2 to 10 minutes, again, depending on the disinfectant that you're using. And school districts seem to just have an abundance of caution when it comes to cleaning. They're taking extra care to clean surfaces that are touched very often, like doorknobs and keyboards, and also horizontal surfaces where coronavirus can live, things like tables and desk counters.
Also, large institutions have taken notice, not just in smaller school districts. Gonzaga University in Spokane called back its students from their program in Florence, Italy. Washington State University recalled students who were also studying Italy in study abroad programs. But here regionally, they're stepping up planning and their public messaging for students here in the U.S. For example, lots of schools have spring break coming up. Students from Washington State University, University of Idaho, Central Washington University, and others may go home to Seattle and then return to their campuses on the east side. What have school officials said, if anything, about how they're planning around that?
Well, it's important to remember that the actual risk of contracting coronavirus is actually pretty low if you're not in China, Italy, or South Korea, or other regions that are very affected by this. For regular people, it seems like universities and other institutions are just making sure that they know the basics, that they should cover their coughs, their sneezes, that they shouldn't touch their face. And they're also making sure that students reconsider international travel. They are restricting travel to certain places, like China, South Korea, and Italy. UW and Gonzaga have closed campus locations in Rome and Florence, but they're also telling students that if they have traveled to these places, to stay home for 14 days and see if they develop any symptoms. And if they do have symptoms, that they should call their doctor to make arrangements and to get checked. Again, it just seems like this is a pretty low risk right now factor, and they just making sure that students also practice that abundance of caution, just so that they don't bring back any infections.
So, Enrique, finally, you're there in Central Washington, a large Spanish-speaking population in the region. There's been a lot of public health messaging through counties in the state, but are you aware of any outreach or other efforts for Spanish-speaking populations, say for farm workers who may be here on temporary work visas, but they still need the important public health information? I'll note that you, of course, previously reported about communicating with those populations for wildfires, but what about in this case?
Right. In this case, it doesn't seem like those organizations exist or are actively going out into communities and engaging with people about coronaviruses. Like I said, emergency management offices and health districts are required by law to various degrees to provide information in other languages like Spanish, depending on how concentrated of a population they have that uses that language. And the health district here in Yakima and others in the region have been putting content out, information out in Spanish through their websites and through press releases. The problem, as I see it, relying on that is that, one, not a lot of people have access, or some people might not have access to the internet, and they might not be web savvy enough to access this information on websites that are in English. That makes it hard to navigate to that information. And also, there's not a lot of Spanish media outlets to disseminate information in Spanish, especially in smaller, more remote communities. Luckily, in the Yakima Valley, we do have a Spanish language broadcaster, KDNA. They haven't found any organizations that are working on disseminating information about coronavirus from either the government or civil organizations specifically for the Latinx community. They have been broadcasting out information from the health district, but again, there's not that many organizations like KDNA that serve this population specifically. What they have been doing is getting a lot of questions from their audience about how to prevent the spread of coronavirus.
Well, it's good information, Enrique, and we thank you for coming on to share it with the audience.
Thank you for having me.
We turn now to correspondent Tom Bonsi in Olympia, who's been covering some of the state government angles. Welcome, Tom.
Hello, glad to be with you.
First, Tom, we know the situation changes, not just by the day, but seemingly by the hour. So we won't talk about specific numbers of cases or things like that. But could you just generally summarize how the state has responded, the legislature, the governor, the Department of Health?
Well, the governor, to start off with, has issued a statewide emergency declaration. King County, Washington, the city of Seattle within King County, followed with their own emergency declarations. The state proclamation gives Governor Inslee emergency powers that he so far has chosen not to use. For example, he could call up the National Guard to augment with their medical corps overwhelmed hospitals. Fortunately, we don't have that situation yet. He also says he has the power to ban large gatherings of people where in a crowded situation the virus could spread faster. So far, the governor has chosen not to use that power. He says he's relying on the judgment of event organizers. Meanwhile, the state legislature is rushing through a $100 million emergency budget appropriation or allocation for state and local health systems. This is going to pay for a lot of things, including the massive overtime that some health districts on the west side have already accumulated, monitoring cases, answering phone calls, setting up testing protocols. There's also constantly expanding call center for concerned people with questions, both at the local level and the state level. I just visited one of the newly set up state quarantine and isolation stations, which are in a rural part of South Thurston County, where people, which was not being used yet, but may be needed in the future for quarantine of people who don't have their own home where they can self-isolate, for example, homeless folks.
Tom, there was recently a change to how people even get tested for the virus, something that people in the Seattle area thought came a little late. Frankly, what was the reason for that change to the testing procedure?
This has been a major frustration of people who've come down with flu-like symptoms, and naturally seeing people in the news dying of this, they're concerned. Do I have coronavirus, or is this the regular old flu? Until this past week, there were very strict criteria in place for who would get tested for coronavirus. Basically, you had to have all the symptoms, so a cough, high fever, respiratory illness, distress in your lungs, plus a likely exposure pathway to someone who is known to have the disease or just came back from a foreign hotspot. And having all those factors combined meant very few people qualified for the test, and there was limited capacity to do this testing at the same time. Now the testing capacity is ramped up a lot in a matter of just a few days. The University of Washington came online with their academic virology lab, and so by multiple magnitudes now increase. There's more testing capacity, and now in the coming days, pretty much if you show the symptoms of coronavirus, even though it's not clear where you might have picked it up, you'll be able to get tested. But it will still be the case that you can't self-refer for a coronavirus test. It needs to go through a doctor who has to see some plausible reason to do this test.
And Tom, in recent years, you've covered how Northwest states are preparing for emergencies quite well, particularly from natural disasters like the big one, the Cascadia earthquake. Is this in any way similar? Is there a playbook already in place for public health emergencies, or is this really somewhat new territory for emergency planners?
I was still a little bit surprised by what I observed over the past week of what you might call doomsday prepping. People, especially in the greater Seattle area, going to grocery stores and cleaning off every last roll of toilet paper, wiping out the milk cooler and the supplies in there. Hand sanitizer is pretty hard to find anymore around here. It'd be slightly comical if it wasn't so serious that this literally is something that people should prepare for. And your question's a good one. And emergency managers have said you prepare for disasters by getting about 2 weeks of supplies to get by on your own for many types of situations, including this one. So earthquake prep overlaps very nicely with coronavirus prep, which overlaps with severe winter weather prep. If you're snowed in, say, you want to have your prescriptions, have a little give in how much supply of prescriptions you have if you have a drug you need to take every day. You want 2 weeks of water at the ready. Cleaning out the milk cooler, I kind of understand. I'd like to have milk in my cereal if I were quarantined at home. That was a new one that maybe isn't in the earthquake playbook. But more or less, getting 2 weeks ready applies to this case as well as many others.
Well, I'm sure the aisles of dehydrated milk are still there, so people can go get the dehydrated milk if they need. Put some water, as long as they got fresh water to mix it with. All right, good and helpful information today. Thanks for joining us and sharing it, Tom. You can find more on this and other topics at nwpb.org. Thank you for joining us here in the unique Northwest.